Welcome everyone. I'm not sure whether you all can hear me. Um, just we'll just go through the few sort of housekeepings and the plan for the session. So it may be useful if you use reaction at the bottom. You can raise your hand and write comments rather than start speaking. So if you stay muted, so the background noise doesn't affect the proceeding. Rupa, who's helping me with the session, is going to keep an eye on the chat. So any questions that you have, we will interact with those. Also, if you keep your video off, then there will be less disturbance for everyone. If you are going to speak later on, then at that time you can unmute and put the video on. But for the time being, may I request you to just put your video off also. So welcome everyone. This is a wonderful occasion in the middle of a major crisis that gives us opportunity to interact, how we look after ourselves and each other, how we take care of ourselves and each other. So the idea came about in a number of ways when COVID crisis hit Swansea, where I work. Everyone, including myself, was quite frightened, and I started a weekly debrief and well-being session in my hospital, Morriston Hospital in Swansea, where we spent an hour looking after each other. And my father-in-law, Dr. Bhaskar Vyas, who has inspired me to run this session. He runs Samanvay Trust, which is a charitable trust through which you may have got the invite. He suggested I run a session for doctors in India as well. And that is how this has come about. So I would like to thank Samanvay Trust and Dr. Bhaskar Vyas, Dr. Rajni Vyas, Rupa, who is my wife and co-traveler in this mindfulness journey over last 10 years, is looking out on the chat and helping me with the session. So thank you, Rupa. And Swansea University is allowing this university Zoom platform. So appreciate the help from Swansea University as well. So right at the beginning, if you have just joined, maybe spend a minute thinking about one or two things that are going well for you, maybe in the work setting or outside the work. What are you doing to take care of yourself in this difficult time? And what is sustaining and supporting you to be compassionate and caring? So just spend a minute or so thinking about it.
waiting room નથી.
So in this session, we will have short meditation practice, then a PowerPoint presentation about mindfulness, and then slightly longer self-compassion practice, and then question answer. But you're welcome to use chat function all throughout if you have a question. I suggest that you just experience the session without constantly questioning. Uh, there will be plenty of time for a question, but immerse yourself in the experience, and that way you may get more out of the session. If you have any trouble hearing or any other technical issue, you can either unmute yourself and let me know now, or use the chat function. So I will just wait for a minute or so, and then we will start with a short meditation. Okay, so I assume that everyone is able to hear reasonably well, and there are no other technical issues. So we are going to start with a short meditation, what we call as a 3-stage breathing. So get in a comfortable position. It's a dignified position. So you are not slouching, you are sitting erect, but not stressing your back. If you are sitting in a chair with your feet on the floor, and start with taking a few deep breaths. In and out. Close your eyes, or if you want, you can focus your eyes on the floor in front. And start becoming aware of your body. And pay attention to wherever there is contact of your body with the floor. Explore the sensation in your feet, sensation of contact, pressure, temperature, hot, cold. And now pay attention to your breath. You don't need to change anything about your breathing. Just identify where you feel your breath most. Is it at your nostril, your upper lip, inside your nose, the back of your throat, in your shoulder, your chest or abdomen. Just observe where you feel the breath most. And this point is your anchor point. If you notice your attention has moved away, then you bring your attention with kindness and gentleness back to your anchor point. So paying attention to your breath, if it helps, you can tell in your mind, breathing in, breathing out. Or you can observe your breathing. Process of breathing. And as invariably it happens, when you notice your mind has wandered, that is a moment of mindfulness. So with gentleness and kindness, you bring your attention back. And now expand your attention to all over your body, becoming aware of contact points between your body and floor, body and chair, becoming aware of light coming through your eyelids, clothes touching your body. And when you are ready, opening your eyes. And arriving in the room where you are. So this is a short 3-stage breathing meditation which can be done um, in a much quicker fashion also. Uh, It is really useful meditation, especially in a clinical setting, between going from one activity to other, between one patient to other, rather than carrying the stress and emotion of one interaction to other. You bring yourself to neutral state. So I'm now going to share a presentation um, on mindfulness, PowerPoint presentation, and then we will do self-compassion meditation. So as I mentioned, I work. Um, are you able to see?
No.
Okay, there seems to be technical issues.
Yeah, you can.
Um, I think you all can see now. So this presentation is on mindfulness with some focus on um, doctors working in India, but most of the presentation is fairly universal. So first thing is, mindfulness is a secular practice and it's not a religious, um, and it is available uh, to people of all religion and people without religion. It has its basis in Buddhism and some people, some scholars think Hinduism, um, but in a present form, it is a secular form. So I'm just going to talk a little bit. This is the presentation plan. Tell you a bit about my background, stress and burnout issue in doctors, little bit about the Indian situation, um, what is mindfulness and its role in well-being. So I'm a consultant gastroenterologist and honorary senior lecturer in Swansea in Wales. Um, I do a lot of advanced endoscopies, ERCP, bowel cancer screening, etc. But also do general medicine um, and quite involved in Swansea University Medical School in a teaching. So, like all journey in mindfulness, it starts with realization of moment of helpfulness. My journey started about 10 years or so ago when I was just finding myself quite restless, um, not feeling very happy in myself. One of my patients with IBS mentioned to me that she had done mindfulness um, course MBSR, and we'll talk about MBSR in a minute. And she found it very useful. So I decided to join the course, which I did in Swansea, and then found it quite useful. So did the level 2 course, and then joined Bangor University, which is one of the world's leading mindfulness research center. in a teacher training, and I've done teacher training retreat twice. I've attended a number of mindfulness conferences and retreats, and have been teaching mindfulness to Swansea medical students, and have run a number of um, mindfulness and well-being study days for doctors, dentists, NHS manager, etc. over last few years. But what I want to really emphasize is that mindfulness teacher is only 5 minutes ahead of its participants. So I really am on a journey, and I'm not really sitting here as a guru, um, knowing all the answers. So the stress and mental health issues are very prevalent world over, but particularly in healthcare professionals. And just taking um, right from medical student time, this issue becomes quite apparent. 30% of students in a BMJ survey had experienced or received treatment for mental health condition while at medical school. And 15% revealed that they had considered committing suicide at some point during their studies. And this is really shocking. These are the students, high achiever. And that continues. So this is BMA survey of 2018. 40% of doctors in UK experiencing symptoms of depression, anxiety, burnout, and 27% responded saying they were diagnosed with mental health condition at some point in their life. I've done some study on burnout as a part of mindfulness and well-being study days that I've run. 80+% of the participants are at a high risk of burnout. And a 2-month post-study, we found Oldenburg burnout inventory score showing some improvement. So even with a very short one-day training, there is an improvement in burnout. And when doctors are not mentally well, feeling burnout, then it affects their patient, their family, in addition to themselves. And this study from US um, showed from 3 US hospitals, 20% of resident, so junior doctor, met the criteria for depression, and 74% met the criteria for burnout. And depressed doctors were 6 times more likely to make medication error, and similarly they will be making more error if they are undertaking any procedure, surgery, etc. So this is really important. I've looked at the burnout data from India, and this publication 2 years ago showed 30% of doctors in India suffer with depression at some stage in professional life. 17% have experienced thought about ending their life, and about 80% at earlier stage, so at a junior doctor level, face the risk of burnout. So these findings are similar, and there are studies from many other parts of the world showing fairly similar finding of high mental health issues and burnout in doctors and healthcare professionals world over. In addition to number of common factors world over, the violence against healthcare profession is particularly worse in India. The IMA suggests that up to 75% of doctors have faced some kind of violence at work in India. And this leads to depression, insomnia, post-traumatic stress, fear, and anxiety. And I understand the law is changing to provide more protections to doctors in India. And whilst COVID crisis is affecting world over, doctors and healthcare professionals world over are suffering, the doctors in India have this additional problem of violence. And this is a data from few days ago showing 175 doctors died with COVID in India. And I'm sure this is incomplete data, so the numbers might be more. Additionally, um, some nurses and doctors died in road traffic accident due to mental and physical fatigue. 5 nurses and 1 doctor committed suicide due to stress and stigma of contracting COVID. In fact, they were heroes. They contracted COVID as a part of their job, and rather than society appreciating, respecting, um, they felt so isolated that they committed suicide. And at least 1 doctor in Maharashtra was murdered by a family of COVID-19 patient. And these are some additional stresses that the Indian doctor faces. So there are lots and lots of challenges, and what can we do about it? I'm just going to pause for a second. So I feel mindfulness is one of the important resources which can help in this situation. Mindfulness is paying attention on purpose in the present moment, non-judgmentally. We'll talk about Kabat-Zinn in a minute. And this definition becomes much more clear by this cartoon. That a person goes for a walk with a dog in a park, but it's thinking about work, personal life, challenges, planning of future, regrets about the past. And instead of enjoying and benefiting from the walk, is just coming back feeling even more stressed. So mindfulness is paying attention to where you are, what you are doing, without judging that whether you should be doing something different or whether other people are doing it right or wrong. And whilst it sounds very simple, it is one of the most challenging activity that we can get involved in. So mindfulness is not positive thinking. A lot of people at the end of initial meditation say that it was a very relaxing experience. And whilst meditation can be, mindfulness is not a relaxation technique. It is not going into trance. It is not trying to blank your mind. In other words, you can develop many hobbies or have many other ways of dealing with the stress, avoiding dealing with the stress. You can take alcohol, drugs, go on a holiday, etc. Mindfulness is accepting and getting in the difficulties rather than avoiding difficulty. So Kabat-Zinn, who was a PhD in molecular biology, um, had learned meditation from Buddhist monk, and he realized that in a University of Massachusetts General Hospital, that to many patients, doctors were saying that we can't do anything about you. Patients with chronic pain, with advanced cancer, with degenerative neurological problems, etc. And doctors will say, sorry, nothing can be done. So he went around the hospital and said, if you have patients like this, I will be happy to help them at no cost. And from his experience, he developed technique called mindfulness-based stress reduction, or in short, MBSR, which is most research mindfulness intervention in world. It's an 8-week psychoeducation program where participants learn and practice mindfulness meditation and mindfulness in variety of activities. And they are given 40 minutes of practice time at home every day. And then there is a 1 full day retreat in between. So this is a radically different approach to living our lives by increasing awareness to present. So if you are listening to this presentation, you observe your temptation to look at your phone or doing something else. And similarly, whatever, even if you are washing dishes or doing some mundane activity like brushing your teeth, bringing your attention to what you are doing, responding to experience based on awareness of what is actually here rather than habitually reacting. So you see someone and you automatically say that I don't like this person, I hate him, and your action is based on that feeling rather than actual awareness that that person is actually smiling. He's there to help you at that point. Maybe the past experience might be different, but responding to the experience based on current awareness and placing our attention where we want it to be, developing new relationship with our experience, and being mind, not doing all the time. So developing a practice of just being every few minutes um, during the day, and you can increase that as you go along. So this really interesting study from Finland, it was done in 3 countries, Finland, Sweden, and Taiwan. So very different cultural background, but exactly same finding. And essentially, your body knows your emotion because before you cognitively become aware of it. So one important aspect of mindfulness is becoming aware of your body sensation. And body scan is an important part of mindfulness training, where you learn to develop understanding of your body sensation, and that will help you. So thinking back, you may have become aware of your experience that you were not feeling well in your stomach before you became aware that there was a ongoing chronic stress, etc. Um, so whilst the body awareness can develop only by being present. If you are living your life thinking about future or past, you will not be able to develop awareness of your body. How does mindfulness help doctor? So there are lots and lots of good studies, some systemic reviews, and some meta-analysis. But in nutshell, it improves the mental health, well-being, and reduces burnout of doctors. It improves compassion and empathy. It improves educational and skill performance. It improves the relationship with co-worker and a teamwork, and it improves the communication. So by practicing mindfulness, your mental health and well-being will improve. Your patient will be much more satisfied because your compassion and empathy as well as your communication will improve. Your education and skill performance will improve and the teamwork will improve. So there are so many benefits for practicing healthcare to learn mindfulness. Resilience is really important in challenging time. And Richard Davidson, um, who's a professor of psychology and has done lots of work, including a lot of work with Dalai Lama. Um, he says resilience is influenced by self-awareness, attention control, emotional regulation, and outlook. And all these factors are improved by mindfulness training. So any action has three components: intention, attention, and attitude. Intention is what are the values um, that is driving you to do that action. Attention is what attention you are paying and what attitudes you are bringing to that action. So attention regulation has three components: to know where your attention is, to prioritize where the attention needs to be, and for attention to go there and stay there. And attitude that are relevant to mindfulness includes attitude of openness. Every experience is a new experience, called beginner's mind. Curiosity. So just because I've done 20,000 endoscopy, every new endoscopy is a new experience. So going with curiosity. Acceptance, that in Buddhism they say suffering is part of life and things will not go well all the time. That is a part of life. And self-compassion. So is there any evidence that mindfulness practice helps? Mindfulness program in a general public, and this is a paper in JAMA, which is a meta-analysis, shows that there is a evidence of improvement in anxiety at 8 weeks and then sustained at 3 and 6 months. Similarly, depression improving at 8 weeks and improvement sustained at 3 and 6 months. And similarly, pain also improving. So this is for general population. In doctors' well-being, there are many studies now showing burnout, empathy, mood disturbance, and personality improving. And Professor Epstein, um, one of the author of this paper, has written a wonderful book called Attending, where he talks about being mindful doctor. What are the biological bases? And this systemic review shows one of the key feature of mindfulness practice is improved emotional regulation. So amygdala um, often can have a overdrive, fight or flight response, which was really important for survival, is present even today, even when we go for interview. The same reaction as we would have when we are faced with a tiger comes up. And mindfulness helps us to differentiate that this is an interview and not tiger in front of us. We don't need to run away. And there are a number of functional and structural changes on a MRI studies of people who have practiced mindfulness. And some of these changes occur as early at the end of 8 week of MBSR course. You can demonstrate structural changes on MRI and a functional changes on functional MRI. Mindfulness-based cognitive therapy or MBCT is now accepted as one of the training modality by NICE in UK for patients with recurrent depression, which is defined as 3 or more episodes of depression. Many medical schools have now introduced mindfulness as a part of curriculum. In Swansea, we have a small introduction to mindfulness teaching going on for 4 years. And recently, the group that I'm part of has been given significant funding to study shortened version of mindfulness. So we are going to conduct a randomized control trial. There is a systemic review, and it's a busy slide, but what it shows is how many studies have looked into particular aspect of well-being and of how many have shown significant improvement. So if we take perceived stress, out of 19 study looking at that, 18 found significant improvement with mindfulness training. Similarly, in anxiety, out of 11, 10 study found significant improvement. So mindfulness shows significant improvement in almost all important aspects of well-being. The key question is, are the benefits long-term? And this study of medical and psychology students who were given very short training, only 15 hours, and 6 years later, the benefits on well-being and coping were sustained. So just 15 hours of training showing persistent improvement. But mindfulness has its own challenges. It's a skill and it needs practice, commitment, and patience. In a true sense, it is a way of life and involves changing values. While some people may not benefit, a very, very small number may suffer moderate to serious adverse effect if they have significant depression and they start this practice without supervision. So if someone has a significant mental health issue, it is best that they learn mindfulness via qualified teacher. And for some benefit, there is a insufficient or inconclusive evidence. And this is really important, and an ultimate slide, how you continue your mindfulness practice. So daily meditation, and I'll talk about Insight Timer in a minute, but there are many other apps available. Doing a mini meditation um, throughout the day, being aware of gratitude, either making it a part of your daily routine or writing it down that you are grateful for every day, and managing your thought distortion or reframing negative thoughts. So this Insight Timer, which is a free app available on your smartphone, it has lots of free meditation as well as free courses that you can enroll into. And it's a really valuable resource. So I'm just going to um, pause here now and see if there are any questions that we need to take. So no one has put any questions so far. So let's just open it up. If you want, you can unmute yourself and ask the question, or if you want, you can write your questions or comment on the chat.
How can we use it with OCD?
I'm not a qualified counselor or psychiatrist, so I do not have any particular experience. Um, unless you are trained in that particular aspect of medicine, I wouldn't really suggest that you start treating patients. Um, from my understanding, mindfulness will be really useful um, practice for OCD, but I would recommend that you look it up. And I do not have any personal experience of working with OCD patients.
COVID-related anxiety that you can use.
For a COVID part, uh, it's really important, and I might share one additional slide about the COVID. So someone is saying that they are surprised to hear mindfulness can have a negative or a side effect. That is really relevant for patients who have a significant mental health issues. So patient with major depression, schizophrenia. Um, in mindfulness meditation, you are spending a lot of time with yourself. And if you have a significant depression or other illnesses, that can become exacerbated. So for people without any major mental illness, mindfulness is extremely safe. There is a comment, it's an evidence-based research, why it's considered it under the spirituality domain. Um, it's mindfulness, all the teacher will emphasize its root is in a spiritual practice. And whilst it's a culmination of Western psychology and um, spiritual practice, its root are in a spiritual practice, and we are not going to um, hide away from that fact. It's a secular practice, so people of all religion and no religion can practice, but the bases are from spiritual practice. So Divya is saying that doing meditation for 40 minutes is hard to apply. And 40 minutes is part when you are doing MBSR course for 8 weeks. It is to embed into your um, skills. So it is like when you are learning to swim, you go for a lesson and you spend a lot of time, you are learning to play guitar, etc. But once you have learned that, you can practice for 5-10 minutes, and that might be enough to sustain the well-being. Um, Manju mentions that she has tried the app Insight Timer and has found it really useful. Thank you, Manju. So I will um, try and share this. I've seen from one of my friend, um, which I really felt was very pertinent when COVID was at its peak in UK. That how do I want to be during COVID? There is a zone of fear, zone of learning, and zone of growth. And often we move from one to other zone. So the progress is not always linear. There are often a setback, and then we grow again. Um, and you would realize that some days you will be in a zone of fear, and then you move to zone of learning or a growth, and then go back to zone of fear. So what I would like to do now is um, do a short self-compassion meditation, and then take further questions, and we will finish in next 15-20 minutes. So I invite you to um, get in a comfortable position. Take some deep breath in and out. Pay attention to contact point between your body and floor. Bring your attention to your breathing. Now just bring to mind the statement of equanimity, which is that you do not control things. And this practice is particularly useful when you are facing a challenging patient who's in a real difficulty, or your family member, your friend who's facing really difficult time. So bring to attention a patient, a family member, or a friend for whom you really care and who's having really difficult time. Try and visualize that person in your mind. And when you are facing this situation in real life, you just remind yourself that everyone is on their own life's journey, and you are not cause of their suffering, but you will try and help. Reminding yourself that being part of this is hard for you. Validating your difficulty of being involved in this, caring for the person. And now paying attention to your breath. And with each in-breath, remind yourself that with the oxygen going in, nourishment and kindness is going in your body. Each time you breathe, feel the nourishment going in your body. Feel the peace and comfort going in your body. And now bring the person who's suffering to your mind. And each time you breathe out, you offer the nourishment and peace and comfort to that person who's suffering. So each out breath, you offer nourishment, comfort, and peace to the person suffering. And now, each in-breath is for your nourishment, and each out-breath is for the person suffering's nourishment. If you wish, you can put your hand on your heart. And you can vary this ratio if you are particularly stressed, suffering. You focus more on your in-breath and your nourishment, your comfort. And if you are particularly concerned about the person suffering, you pay more attention on out breath. Remind yourself of that everyone is on their life's journey, and you are not responsible for anyone else's suffering, but you will try and help. And becoming aware of your body in contact point between your feet and the ground, allowing more light to come through your eyelids and opening eyes if you have closed. You can stretch. So just going to open it up. I'm just going to unmute everyone. If you wish, you can um, take uh, come on your video um, and feel free to communicate. As I said at the beginning, um, we all are in this journey and will be interested in your comments, your views.
Good afternoon, Dr. Dave. Which time of the day is best time to do this?
I think anytime, that is, if you can do in the morning and evening before going to bed, that's best because you can have a much deeper and sound sleep by doing it before going to bed. And morning is the best time so that you are in a right frame of mind to deal with challenges of the day. But you can do, say, the last meditation we did together, um, you can do in a real life without any extra time um, involved in the clinical care. You just, as you are approaching patient, um, you just remind yourself that this is hard for you. Um, you are not responsible for the suffering, and you can't control people's life. Then nourishing yourself, sending well-being wishes to your patient or person suffering, and closing in again with just reminding the message of equanimity. So it literally takes 1 or 2 minutes. Similarly, a three-stage breathing where you just become aware of your feet or the contact point of the chair. Just breathe for a minute and then you carry on. So that mini meditations can be done throughout the day. Um, the main meditation, if you can do in the morning or before sleep, will be great.
Thank you.
Um,
40 minutes.
Divya is asking about 40 minutes. So no, 40 minutes is not necessary. Whatever time that you can spend, then 40 minutes may be too much if you are starting the practice on your own. Um, so you can build it up, start with maybe 5 minutes and then gradually increase. And on an insight timer, you can select the meditation, the type of meditation, but also length of the meditation that suits you. Um, so let's just be here for a few minutes. If the questions come up, um, use the chat or um, audio facility. Number of you are asking about the name of the app. It's Insight Timer. Um, there are a number of other apps also, but this one is free, has got lots of resources not only standalone meditation, but you can join number of meditation courses. There is a really good free version, but on a small cost, you can get a premium version, which will allow mm, more classes and some extra facility. But even the free basic version is very good. I think we'll say goodbye and hopefully we'll meet again. So thank you, everyone. Appreciate you joining on a Sunday, and hopefully the situation in India improves. Being a doctor from India and being away and seeing so much of suffering in India just makes us feel very uncomfortable not being there, not helping on the ground. And we are there, at least in spirit. So thank you all.